It's a five-letter word no one wants to think about, but COVID is still lurking in Ontario and around the world. Wastewater shows cases are rising, although the good news is hospitalizations seem to be steady. But it has many calling for booster shots to be expanded.
I couldn't get out of bed. That was Sunday because my headache was so bad and not responding to Tylenol at all. And so today is just kind of achy and tired.
Patricia Burke came down with COVID during the weekend. She wasn't surprised she got it, but she is surprised at how sick she's been feeling.
I had the worst headache of my life on Sunday.
According to the Ontario Science Table, while still way down from the winter, COVID cases have been increasing since early June.
We have about 3 times as many people in the hospital with COVID-19 as we did this same time last year. The wastewater signal is going up, and that's a good indicator.
In Quebec, anyone over 18 can get their 4th shot, but in Ontario, the majority have to be 60 and over to get a 4th dose. Epidemiologist Raywat Dionandan believes that needs to be expanded.
We have an increase in transmission. B4 and B5 are supplanting B1 and B2. Those have potentially a higher risk of reinfecting those who have previously been infected. And a 4th dose increases your ability to prevent reinfection. So I think now's the time.
Premier Doug Ford was asked about expanding eligibility for boosters today. He didn't rule it out.
Yeah, we're getting that question more and more. If you can just bear with us for a week or so, 2 weeks, until we get the Minister of Health in there fully briefed.
Verk, who is losing money because she has to stay home from work, has her 3rd shot and was waiting to be eligible for her 4th.
What's your message about 4th doses?
If, the second eligibility opens up, I would go and get a vaccine.
Currently, Ontario's Chief Medical Officer of Health is reviewing vaccines, and there's much for him to consider in addition to whether everyone should get a 4th dose. For example, should these doses be like the annual flu shot or maybe given twice a year? Will the current ones be effective, or do they need to be adjusted for new strains? It is a constantly shifting dynamic.